Hello. Today in this presentation we will discuss the part 2 anatomy of heart, that is the presenting parts of heart. Let's see what are in this presentation. If this content is useful for you, then please like, share and subscribe my YouTube channel and follow my Facebook page NG's Corner for Nurses. And you are most welcome to comment. Presenting parts of the heart consist of apex, base, surfaces and borders. Surfaces include three surfaces like sternocostal surface, left surface, diaphragmatic surface, and the borders, right border, inferior border, left border and superior border. First is apex of the heart. It is a conical area formed only by the left ventricle. It is directed downwards, forwards and to the left. It lies in the left fifth intercostal space, about 9 cm from the midline, slightly below the medial to the left nipple. Apex beat is a forward thrust felt in the left fifth intercostal space during ventricular systole. Please see the picture. The apex is denoted. Then base of the heart. It is a quadrilateral in shape. It is directed backward and to the right. It is formed by two atria. 2/3 by posterior surface of left atria and 1/3 by right atria. As we see, that is superior vena cava opens in the upper and posterior part of the right atrium, and IVC, that is inferior vena cava, opens in the lower and posterior part of right atrium. 4 pulmonary veins, 2 on each side, open in the posterior surface of the left atrium. Vertebral level of the base of heart is T5 to T8. Next, coming to the borders of the heart. First is right border of the heart. It is formed by the right atrium. It extends from the opening of superior vena cava to opening of inferior vena cava. The border separates the sternocostal surface from the base. A shallow vertical groove known as sulcus terminalis accompanies the right border and corresponds with crista terminalis in the interior of the right atrium. Next, inferior border of the heart. It extends from the opening of inferior vena cava to apex of the heart. It separates sternocostal surface from diaphragmatic surface. The border is accompanied by the marginal branch of right coronary artery and its corresponding vein. Close to the apex, it presents a notch known as incisura epicis cordis, which gives passage to the anterior intraventricular branch of left coronary artery. Next, coming to left border of the heart. It is an ill-defined convex border separating the sternocostal surface from the left surface. It extends from left auricle to the apex of the heart. The border is accompanied by the marginal branch of left coronary artery. Next, superior or upper border of the heart. Upper border formed by two atria. This picture gives a clear description of heart borders. The 4 different borders are denoted here with 4 different colors. First is right border. Right border extends from the opening of SVC to opening of IVC, that is denoted with red color. Next is inferior border. Inferior border extends from the opening of IVC to apex, that is denoted by the green color. Next, coming to the left border. Left border extends from the left auricle to the apex, that is denoted by the yellow color. And the last one, that is the upper border, which is formed by the two atria, that is denoted by the blue color. Let's start the surfaces of the heart. First is sternocostal surface of the heart. It is directed forwards and upwards. Separated from the base by right border, from the diaphragmatic surface by inferior border, and from the left surface by left border. The sternocostal surface is formed by the following parts: anterior surface of right atrium, anterior surface of left atrium, 2/3 anterior surface of right ventricle, and 1/3 anterior surface of left ventricle. Next, diaphragmatic or inferior surface of the heart. It faces downwards and backwards. It is formed only by two ventricles, that is 2/3 by left ventricle and 1/3 by right ventricle. Left surface of the heart. It is directed upwards, backwards and to the left. It is mainly formed by the left ventricle and partly by the left atrium and its auricle. So this is about the presenting parts of the heart. Thank you for listening.